I'm often asked by my patients, what are some of the most important qualities that I need to achieve a high level of health? And in thinking about this question, I realize there are many important qualities, but there is one that stands out as one of the most common that I've seen consistently in patients that have made the most profound changes in their health. In fact, this one quality is really the foundation of making lasting change. Without it, you live at the effects of your life, but with it, the ability to make change is at your fingertips. With this one distinction, I've seen patients make breakthroughs when everyone else said it's impossible. Hi, I'm Dr. Mario Mancini, the Medical Director of the Center for Integrative Care, a functional medicine and peak performance center here in San Diego. Now, this one factor may seem so simple and too good to be true, but unfortunately, because it seems so obvious, it's thrown off to the side. Now, I know you're saying, tell me, what is it? Okay, I'm gonna tell you now, but please don't take this lightly. So here it is. The consistent quality in people that I've seen achieve the highest level of health is they take full responsibility for their health. Simple, yet so powerful if you can get this. It's about owning your health. So what does that really look like? Well, here's what it looks like. They do not give up their health to anyone. They don't blame their doctor, their insurance company, the healthcare system, or their parents for those bad genes. And they don't complain to their buddies or girlfriends that it's their wife's fault or their husband's fault. Some of you may be saying, it is my parents' fault for giving me that gene, and that's the reason why I can't lose weight. Or, I really don't have enough time because my kids, my job, or because of that person, I can't exercise or eat healthy. Listen, as long as you believe those things outside of you are responsible for your health, you're giving up your power to take your health back. See, in order to take back control of your health, you must get to that realization that if it's gonna happen, it's up to me. Now, I know that there are some of you listening right now saying, oh no, I do complain and blame everybody else. I guess there's no hope for me. Yes, there is. Listen, I've seen patients get to the point in their health where there was a switch. Something in them said, there's more to life than this and I want it. And they changed. So hang in there, please. If not for you, then for your family who you want to be an example for. Think about your life right now, specifically your health, and ask yourself, what is it about my health or body that I need to change now? Or the quality of my life will never be the way I envisioned it. Really think about this for a moment. Now, I also know that there are some of you still thinking, really? That's it? It can't be that simple. Hear me now. I have found in my 19 years of working with patients, thousands of them, that most people make their health way too complicated. Ladies and gentlemen, getting back to the foundations of health is what most people miss. Why? Because we are constantly getting bombarded with information, with the new quick thing. Why is this, Paulus? Well, because anything new creates excitement, stimulation, basically a change in our emotional state. So then the next thing you know, you're back where you started. So just hold for a moment and breathe. Come on, take that breath. Listen, I understand our minds are always running. We're just trying to keep up with it. So please just take a moment and give yourself a chance to get back to the basics. This reminds me of the first time I tried to get my fireplace started. I threw a couple pages of newspaper in because I wanted to create that fast flame, and bam, I got it. The surge of flames, it was awesome. Then, in moments, it was gone. Now, after about 20 minutes and 3 full newspapers, I realized I need to do something that's gonna give me that long-term burn. So what did I do? I went to the grocery store and got a Duraflame log. Point of my story, don't get caught up in the peripheral bright flames of the next best thing. It will leave you sitting there in ashes, no pun intended. So, if I got your attention, you're still here. If not, you're probably looking for the best next thing or listening to some cool music. Anyway, when you decide to take responsibility back into your health, you begin to look at the problem with full acceptance that you are part of the equation. Once you do that, you can be part of the solution. See, we live in a time that we can use the best of all medicines. Taking responsibility means to go beyond just treating the effects of your health and start looking at cause. In order to do that, you need to start being proactive in your healthcare. This is where looking at your health from a functional standpoint instead of symptom-focused mindset has its greatest strength. What I mean is to begin to take a look at your health before the bigger conditions manifest. And even if you're in a major health crisis now, integrating a functional approach causes you to become more focused on factors such as diet, exercise, nutrition, impacts of stress on your physiology, as well as the impact of a positive mindset and, of course, a negative one. See, Western allopathic medicine is a powerful medicine, especially when there's a crisis or significant health condition that requires more immediate attention. Now, the responsible patient is one who has both the medical doctor and the functional medicine specialist on their team. So think integrative. Taking responsibility means beginning to look at the bigger picture of your health beyond solely symptoms, signs, and disease. It means to begin looking upstream and asking yourself, what else can I do? How else can I help myself? See, we as healthcare providers are here to serve you, but you need to take responsibility first and foremost in your own health. You want to start focusing on thriving, not just surviving. If you focus only on survival, you're just going to do what's necessary to get by. You'll do just enough to get out of pain. This is a lower standard of health, what I call the pressure cooker. You know, I'm in pain, I need to do something to get out of pain. Then your goal ends up being just doing things to get out of pain, and you lose sight of the bigger picture. What does that higher vision of health look like? It looks like vitality, strength, vigor, fertility, energy, everything we call being healthy, and you have the ability to experience that. Listen, if you take enough medication, you'll feel no pain. In fact, you'll feel nothing. Now, there's always a place for medication, but don't let that be your end game. Let medication, if required, help you reduce your suffering just enough for you to create some increase in momentum in other areas of your health. So the key is to have a bigger vision for yourself just beyond managing pain. Focusing your attention on thriving, taking responsibility, integrating the best of all medicine to help you bridge the gap from where you are to where you need to go. You got to get in the front seat of your health because most people are in the back seat of their healthcare, not taking responsibility. And when you're in the back seat, you're eventually giving up. When that happens, you start to become a statistic and your health declines. So don't do it. Listen, the responsible patient is proactive, not reactive in their healthcare. When you don't take responsibility, you live in fear and succumb to being the effects of your condition instead of cause. So, take responsibility, demand more from yourself than anyone expects, and be an example to your family, your friends, to what's possible. So here's my question. Are you willing to take on this challenge? So if you want to find out more about how we can assist you with your specific health concerns and how we can best integrate the use of science-based natural medical modalities along with your current healthcare in a safe and effective way, contact our office to schedule a free consultation with one of our functional medicine specialists where we can answer any questions you have to find out if and how we can help you with your healthcare needs. I'm Dr. Mario Mancini, and I wish you the best.